So one thing that surprised me as I incorporated endoscopic laser surgery into my practice more and more is the OR techs and the nursing staff really are excited about doing these cases. If you set this up right, so that you've got good optics and you're taking the time as a surgeon to show the entire operating room what's going on under the microscope, which we do, the nursing staff really like seeing this stuff happen. They know what we're saving the patient. They know that we're saving them at least maybe 7 weeks of radiation. And in recurrent cases, unfortunately, I do a lot of that as well. We're saving someone we're offering someone the chance to save their larynx. They enjoy it now because they feel really part of something very new and something that really helps out our patients. And so while there was initially a little bit of grumbling sometimes when there's a laser case, they've got it down. Because they're motivated to do these cases when they see the results, and it's fun. It's something new and keeps them engaged in their daily practices in the OR.
At our institution, I'm the head of the Laser Safety Committee. Our committee consists of a number of nurses, including one laser safety officer who evaluates and maintains all of our lasers within the facility. We have a number of nurses in each operating setting who are familiar with C02 and other lasers and come to staff or man the instrumentation while we're using it. In addition, our anesthesiologists are very aware of our use of the laser, and I think close coordination and communication with our anesthesiologist, as we're often sharing an airway in the management of these procedures, really helps prevent complications. We are very pleased that we have not had any serious complications with the use of the laser and find it in many ways to be as safe or safer than other technologies. Again, I think the most important component is making sure that all the staff are very aware of what and how the procedure is being performed. This can be tricky because of the number of different types of instrumentation we may use on an individual procedure. We may switch from a shaver to a laser, for example, and need to be cognizant of this and warn our anesthesiologists who may not have noted that we are doing this. I think that as long as we stay in close communication, everyone has been very pleased with the use of the laser and actually enjoys coming to those cases as they feel they're part of the team.
So our staff enjoys working with the CO2 lasers. They've become very familiar with the product. They understand that it will most likely facilitate the operation for me, making it easier, making me happier. So they are pleased with that. At the same time, they understand how to use and position the CO2 laser. It does require that there's a specified technician or nurse in the OR who runs the laser, who turns it on and off for us. And in addition to turning the laser on and off, she maintains safety principles and regulations. The staff feels the instrumentation is reliable and understands how it works, so they enjoy working with it. It's a regular part of the setup for endoscopic laryngeal and tracheal cases.